Hello and welcome to our presentation, Tips for Future Advanced Standing Dental School Applicants at the ADEA CAAPID Virtual Fair. The presentation today is featuring admissions representatives and program directors, and we're going to discuss about preparing for the admissions process. We'll cover topics like where to apply, which exams to take, how to prepare, and COVID-19 disruptions in admissions, as well as expected professionalism. Welcome again. My name is Emily Reinberger. I'm the Senior Director of Application Services at ADEA, and I'll be moderating today's panel discussion. Corey, would you like to introduce yourself first?
Yes, hi, I'm Corey Berry. I am with the Herman Ostrow School of Dentistry of USC, and I am the admissions counselor for the ASPID program, as well as the advanced education programs.
Dr. Potluri, could you introduce yourself?
Hi, Anita Potluri. I am the director for the International Advanced Standing Program at University of Pittsburgh. Along with that, I am chair of diagnostic sciences and an OMF radiologist here.
Hi, I'm Marcy Kolb, and I work at the University of Colorado School of Dental Medicine. I am the manager of our Advanced Standing International program.
And I'm Luis Pimenta. I'm the program director of the Advanced Standing program at Adams School of Dentistry at UNC. And also I'm a professor in the Department of Prosthodontics, or Division of Prosthodontics at the Comprehensive Oral Health Department.
Thank you all so much for joining us today. We're going to kickstart our first question. And Corey, if I could ask you, how would you respond to questions from applicants about where to apply, including how many schools someone should consider?
Well, the first thing I think is, as far as how many schools, on average, typically students or applicants apply to, on average, 7 schools across the country. My biggest advice to finding which schools to apply to is by researching the schools. First thing is researching them by visiting their websites or visiting the schools if that's available during COVID, and also contacting the school. So those are the 3 things that I would do first by determining, which schools I should potentially apply to. Now, some schools like ourselves, we do have virtual information sessions. I do recommend attending those. So again, visiting the website is very important in determining, what that school has to offer. During these virtual information sessions, we give you information about the community. We give you information about the patient pool. We give you information about underserved, populations, what types of patients come to our clinics. So those are very key, important factors to determine when, deciding which schools to apply to. And again, I would at least apply to 7 schools.
Thank you. Does anybody else have advice for applicants about when they're considering where to apply?
Yes, I think Corey comprehensively responded to the main aspects of it. Another thing to consider is where you're living and if there is any school in the state that you're living or the city that you're living in, if you want to stay in that area. So you have to consider that as well, or the region of the country, if it's on the East Coast, West Coast, Central. So many times when students contact me, they always express that, okay, I live here nearby, or it's an area that I have already experience living and I would like to continue in this region, or I would like to move to this region. So that's also another thing that you have to consider, the location, the climate, the weather. So those are very important aspects, especially if you're coming from different countries. You have to take into consideration because the United States is quite big, it's a quite large country, and the weather is another aspect that you should consider when you're applying.
Just one thing to add in, which Corey sort of covered, but I think the reason we recommend applying to more than one place is because of how competitive the application is and how many people are actually admitted to these programs. So We're not recommending you apply to 7 because we want you to do more work. We just want to make sure that you have good options.
I think absolutely. I think all of you have covered very well. But one thing I want to add on top of it is please consider sitting with your family and deciding the flexibility of the family of the moment before you apply. As Dr. Premente said, its location is very important, and considering the geographical location that you would be willing to move and what is your family flexibility for the moment is very important, because when you have applied to the schools and you heard back, and then if you cannot accept the school, then the schools have a problem of recruiting back and going back to their next school or something. So making the decisions before in hand, before you apply, would help not only the candidates, but also the schools to recruit the appropriate candidates.
That's all really great advice. Another question, Dr. Pimenta, maybe you can help with this one. Applicants often ask about which national board exam is required and if there are other standardized test recommendations. How do you recommend they find the answers to these types of questions?
Well, I think to find the answer for these questions, basically they should contact each program to get a specific answer. But in general, the National Board of Dental Examiners is the standardized exam that most of the programs request. We used to have the NDB 1 and 2. Now we have the integrated one. So the NDB 1, I think, was finished, or there's no more application since July last year. And I think the NDB 2 is going to be ending in 2022, I think August 2022. And then we're going to have the integrated NDB. Another, some programs recommend, others don't, is the ADEA. Specifically UNC, we don't recommend or we don't request that. But so to get that specific answer, most likely you should contact the programs, the program director, or whoever is responsible for admissions in the process, and get that information from each specific program. That's probably the best way to do it.
Yeah, I think excellent, point, Dr. Pimente. And also visiting the CAAPID directory for each CAAPID page for each school when it's published will give most of those that information, what that school requires. And as Corey said before, looking at each school's website will give you a lot of information. And most of the schools have frequently asked questions posted on their website. A lot of your answers or questions, answers for your questions will be there. And so we all, I think this is a common consensus from among all the schools is, please do your research, visit their website, look it for most of the answers. And if you do not find it there, definitely we welcome your questions, and you can email one of the admissions officers, and definitely one of them will get back to you if this question was not answered anywhere else. That would help school also to easily maintain their application pool. Otherwise, if every question reaches the application pool, probably you might not get an answer right away.
Yeah, we're very open, myself and especially open to questions. I always encourage applicants to contact me if they cannot find the information on the website or, through the frequently asked questions. There's so many different resources now these days for all of these application services that it can get kind of confusing. So my advice also is to always go to the source. Don't necessarily rely on other forums, such as Facebook forums that many candidates belong to. So again, that's been a lesson learned for many, even current students that we have at our school, is that they contacted the source instead of relying on hearsay and conjecture.
That is really great advice. There's also a lot of questions about hand skill preparation that we get from applicants. And it's been an important part of the process for all applicants and for many programs, especially this year. What advice do you have for those looking to strengthen their hand skills?
Okay, I'm going to take that. And again, as reiterated before, researching the schools is very important. Each school might have a different approach towards these scan skill or requirements for these skill assessment tests. So look at their website. Most of them specifically give a lot of information on what they want to see in these hand skills, how they are conducted, what are they going to provide, venue, and all those things would be specified in most of the school's website. If not, reach out to the school, find out. I think most of them would like to have some sort of skill assessment. Physical bench testing exam is very common in most of the schools, and their requirements are specified on their websites. In the lieu of the pandemic, a lot of schools have moved on to either OSCE type virtual kind of an exam, or like, multiple choice based kind of an exam, like mimicking a clinical bench test, but a virtual kind of a bench testing exam. Some of schools did that in this last year. Probably they might be looking at it again if this pandemic doesn't allow a lot of students to travel during this time. But knowing those requirements and practicing them, and appropriately either in one of the dental clinics that will allow them to shadow or practice in the evenings, improving their hand skills, and especially having a good command on theoretical knowledge of those, what they are asking, and also skill improvement, hand skill improvement by practicing them is very important. If not, there are a lot of dental schools who offer these bench testing prep programs. You want to find the right program that meets your needs, that covers most of the foundational skill set that you need to address for most of the dental school requirements, bench testing requirements. You do not want to go and do a bench testing prep course which is proprietarily helping towards only that school. Find out this program that meets most of your needs, and you can go practice there. But I would strongly recommend the foundational knowledge and researching the school, and hand skill like preparation by themselves at home, looking at the requirements and the standards of passing those tests carefully on each school's website.
Just to add in just a little tidbit. So the University of Colorado, we don't have that information on our website. So what we do typically is we tell folks to just do preparations over the course of the year and not to really prep at the last minute. So don't start prepping when you get an interview invite, but just keep doing your prep so that you can be up to speed. And so if you get a last minute interview, you're not necessarily put at a disadvantage. But we also recommend textbooks that are like American Standard textbooks for prep, because we provide the information only to those who are invited to the bench test. So once you're invited, you get further information, and then you get further information than that on the day of the exam. So we are not quite as informative on our website, but I think some programs might operate similarly to that.
I think you both gave very important information. I'll share a little bit of our experience here at UNC this past year. So we could not offer the bench test, and as a professor in prosthodontics, so I truly believe that hand skills is still important in our profession, but dentistry is changing considerably, and I believe that having the knowledge, the basic principles, is more important than hand skills. The way that I see as a professor in prosthodontics, if I select the right student that has the right knowledge, I'll have the time to practice as they go through the program. So I would rather select the right student with the right profile for the program, with good foundation in knowledge, with the principles of preparation, biomechanical principles, that understand the process. And then we can train the students to deliver that by practicing. I used to say that hand skills is 92% or 98% transpiration and 2% inspiration. So you just need to practice. The more that you practice, if you have the principles, you're going to be able to practice and deliver. So my point is, and our experience, what we did, we didn't have the bench test, but throughout the process, we put some questions about the principles of preparations for restorative and for prosthodontics, some basic principles of removable prosthodontics. The students answered those questions, and then as they came for the onboarding, on the week of the onboarding, we put them in the lab for 1 week practice. So we tried to come up with an alternative for them. And actually on that 1 week of onboarding practice, we calibrate them. And as they start the program, they are doing fine. So those are alternatives that we have to consider when we are organizing a test. We know that with the pandemic, it's not going to be possible to bring people for those tests. But I think if we are creative enough, we can find alternatives that we can still assess the knowledge of the students. And later on, if there's any need for remediation or more practice, just buy more plastic teeth and practice more in mannequins, and they will be fine.
Yeah, this certainly highlights the research aspect of finding a program, as even the programs here represented are different in your responses as to how you recommend people prepare. Thank you so much for that advice. Let's shift a little bit, and Marcy, maybe you can help with this one. There are many pieces of the admissions process, and applicants often interact with the program representatives at a variety of times. What recommendations do you have for applicants to maintain their professionalism throughout the process?
Sure. I mean, we've already touched on a couple things. Corey had mentioned, definitely search the website before you make contact. I think that's one of our biggest concerns as admission folks, is that we get a lot of inquiries. And sometimes I think that people think if we hear your voice, it's going to make a difference in your admission process, which it won't. Or if we see an email from your name, that it would make a difference. And at least for us, that doesn't really have much impact. It might have impact if you aren't professional though. So that's one thing to keep in mind. But basically, I would say make sure to read the webpage thoroughly before. Our webpage has some drop-down menus on it. And I know people will say, well, I can't find that. And it's just like you have to click a plus sign next to something. So just making sure you're operating through the website entirely. In the US, it's pretty customary to leave voicemails. And in other cultures, it's more customary to call and call back. So make sure you leave a voicemail, because we won't know that you called if you don't. And additionally, don't call us back 30 seconds after you called us previously, because we probably have caller ID. And additionally, we're probably busy. So that's something to keep in mind. Also, when you're emailing different folks, you want to make sure that you have their title correct, or their name correct, or the language in which you use to connect with them should be professional. So for example, if you know you're emailing a doctor, you should email them doctor and then their last name. That's traditional in the US. I don't happen to be a doctor, so you could say, Dear Miss Kolb, or you could say, Dear Marcy, because I don't mind. But in the case of if you don't know, you should say, Dear Miss Kolb. We see Dear Kolb sometimes. We see a bunch of different things. Also, we see a lot of text language sometimes. So make sure that you're using email proper communication, that when you communicate with folks. Also, one of the things that we see a lot is that people will try to find the right answer that they're looking for instead of believing that the first answer is accurate. So when you're in an office setting, don't ask another person just to try and get an answer that you want. Usually the offices are small enough that we're all on the same page and are going to provide the same answer regardless of our title or what position we hold. And then just a couple of other quick things. During your communication with us, you are kind of branding yourself to us. So just make sure you're thinking of that. How would I want to present myself to these schools when I'm communicating with them? Because we do take note of how you are communicating professionally or not. And then very lastly, just remember that you are one of many, many candidates. And so just be patient with us, I guess, is the best piece of advice. So we may not be able to get to your need right away, and it might not be urgent, even though you might think it is. So just be patient with us. Most of us are care a lot about you guys and a lot about your success. So be patient with us, and we should get off to a great communication pattern.
Yeah, I also, piggybacking off of Marcy, I get this a lot because my name could be spelled so many different ways because my name is a male name and it could also be a female name. So definitely do your research before sending an email. And if you're not sure, as Marcy said, instead of saying Miss or Mrs. or ma'am, you know, if you're not sure if it's a male or female, just say the name because I get that a lot. I mean, I get it tons where a lot of people will start out the email saying Ms. Corey or Ms. Barry or Mrs. And I'm thinking, well, how do you know? So if you don't know, just put the name because you never know how that can affect you. Like Marcy said, you're branding yourself. We remember certain things. You'd be surprised at what we remember. So always be reasonable with your approach. Be respectful. And I think just spelling a name correctly it's simple, but I think it means a lot, especially when the signature is in the email. Oftentimes I will get applicants that will email me back 3 or 4 times, but guess what? They'll spell my name wrong all 3 or 4 times. So I think very important to pay attention. I guess that's the bottom line here is what I'm saying is to pay attention.
And the core of these programs, we are international programs, so we understand cultural differences, we understand different approaches, we understand everything. However, we are now here in the United States, and I hope as an international, because I am an international, I came to United States, we need to blend in the community and we need to follow the rules or the culture that we have here. Understanding that there are differences, we all understand that, but try to always understand what is the American way of doing business and do the business following the American way because we are here in the United States and that's what we have to do. But if there's a small mistake, we all will understand that's not a major problem, but try to do the best to be part of this process in an American way. Basically, that's it.
Absolutely. I think one piece of advice I have is please proofread your emails. You think that you are sending an email to one school, but you are addressing it to a different school. I've seen this happening, or sending mass emails to different school, like in multiple schools at the same time, but that might not be pertaining to another school that you have sent. So those mistakes show your sincerity towards the school and could be interpreted completely wrong by the different schools. So please proofread your emails, keep it as professional as Dr. Martinini and Premente and everybody said that keep it very professional as possible, as much as you can learn from this culture and try to.
And I forgot one, oh, sorry. I forgot one piece of that, which is it kind of goes along with what Dr. Pimento said, which is, so when you are contacting the schools, typically it's best to contact the advanced standing program if you're applying for the advanced standing program. And sometimes we'll have folks that email like every faculty in the building, and then they forward every single one of those on to me and my coworker. So, so it's best if you just kind of are in communication with those folks who are associated with the international program, I would say. And then should we be able to outsource something to the research department or, you know, another department where maybe you could observe or something, we would be able to highlight that for you versus the opposite way.
This is all really great advice. I would even extend the idea of being respectful and professional to the applicants as they deal with the application services and customer service. All parts of the process are important to remember that. Thank you. I'd like to turn to the pandemic and to ask you all about how COVID-19 has changed how the programs are processing both on the admission side and in the curriculum. Corey and Dr. Potlouri, could you help provide perspective both from the admissions and from the program side on how the pandemic is shaping the programs in your respective areas?
Yeah, well, from the admissions side, I can say pretty much everything has changed, starting with the communication with applicants. Again, we can no longer invite you to the school to visit, to take a tour of the school, to take a tour of the campus. Even getting on campus is very difficult. If you're not an essential worker, or if you're not a person or a student that should be there or that's approved to be there, you can't really come to the school. We don't have preceptorships anymore. But again, we do offer different things to make up for those things that we're lacking since COVID, such as virtual externships or virtual preceptorships. So again, that's why I encourage every applicant to, you know, research the website, call the admissions office, see what other types of experiences you can gain from, you know, just participating in something virtual. Another thing that has changed is our interview style, of course, just like we all have discussed. I don't think anyone has had a bench test this past year because of COVID. So we've had to reinvent how we do interviews, which has been very successful. It's been very surprising, but also, you know, successful. We've gotten just as good candidates this time as we did in previous years. We didn't think it was going to go so well, but again, it's just so different. It's a different world for everybody. So I think just preparing and expecting the unexpected, you know, is the best way to go here and out, because planning is not the way it used to be.
I think that's excellent, Corey. You nailed the admissions aspect of it. The similar way here in Pittsburgh too, I think we are much more flexible now. And we have highlighted the changes and the flexibility options in our CAAPID page. So do your research. Our website reflects the flexibility opportunities or additional or a different kind of opportunities that are available now. And especially, I think, at least on our website or CAAPID page, it shows in bold the changes and the flexibility options that we have provided during this during this pandemic time. And I think if I'm not wrong, we have highlighted in the brackets also saying that these are temporary measures due to the pandemic. So you can see what are the things that are accepted and not accepted, or how flexible we are with these like application materials during this time. And yes, Corey, you're right that nobody, I think, has offered a physical bench testing. Instead of that, I think we all did Zoom kind of interviews, small group sessions, small rooms, Zoom rooms, those kind of things. They actually worked like magic. Like, as you said, we never expected them to go so smooth. And I think even we did recruit the candidates, a much nicer, diversified portfolio kind of candidates that year, and strong candidates as well. So everything sounded like ended up good in the end. Instead of doing a physical bench testing, Pittsburgh, we have offered a virtual OSCE kind of an exam, foundational clinical, like how Dr. Premente was saying, a foundational knowledge kind of it is, pretty much like case-based kind of scenarios, or showing the pictures of the clinical bench testing things, and how would you correct this, or how would you address this issue of the prosthodontic preparation or restorative preparation. We also went ahead and actually gave a one-day CE course, pretty much covering a very broad topic of restorative and prosthodontic aspect, like in prosthodontic curriculum. And then I think we offered this virtual OSCE test, which is more granular than the CE course that we have given. And I think the students have appreciated it a lot. And it gave us insight into the critical thinking aspects of the foundational knowledge of both restorative and prosthodontic abilities of the student. Like how Dr. Premente said, this time around, especially because of the pandemic, we always had that summer calibration sessions, but this time around, keeping that in mind, that the students did not have opportunity to showcase their physical clinical hand skill abilities, we have started putting together our summer program with an intense 1-week workshop of the hand skill improvement, especially in the restorative and prosthodontic area, apart from what we usually do that are required for the first and second year courses with competencies in additional to that. So I'm sure that most of the schools are thinking along the same lines, and a similar kind of, or most of the programs have similar kind of calibration mechanisms before they go into taking the competencies. All of us are thinking for the benefit of the students, and are trying to be as flexible in our requirements without compromising the quality of the students that we take. The strength of the student is in the foundational knowledge of their clinical dentistry. If we see that, and if we see a strong candidate, definitely I'm sure every school will welcome them. And that is what each school is looking. And we are all trying to be as flexible as possible during this pandemic, trying to offer different ways of recruitment, I think.
I agree with both of you, and the applicants just need to understand we're not here to punish anybody. We're trying to identify the best applicants that would fit in our programs, and it's a two-way road. So the students also need to find the best school for their needs. So in the end, we are all trying to just find a good match. I think this is the way to describe. We are in both sides trying to identify the ideal match for us. We want to get the best students for us, and the student wants to get the best school for them. It's a matching process, even if it's not a formal matching system, but we're trying to just identify people that are applying to our programs that we think that they will do well, and they will develop well in the program, and they will become successful students. We don't want to fail anybody. We want to make them become good professionals practicing dentistry in the United States.
Just to then answer, I think, the second part of the question, which is how are we operating once you're here? At least for us, we did have a time period for those 2 or 3 months where our clinics were closed. Everything was closed during the shutdown. So we were 100% online. There was a little delay from our spring break and those sorts of things. But once we started to be able to see patients again and to come in for some preclinical work, we have all of our didactic online. We're continuing to have that entirely online. But if something needs to be in person, it is in person with very strict social guidance, social distancing guidance. So our patients can't come in as many numbers as they used to. So we've adapted our clinic hours and our clinic sessions and those sorts of things. And I would imagine that most schools have done a similar thing. Like we never had Saturdays before and now we do. We never had evenings before and now we do. So I'm sure everybody has adapted in that regard, but I would imagine people still have some online component at this point due to the pandemic.
Yeah, and if I can just add really quickly, yeah, that has changed dramatically with us as well. Last year, of course, just as Marcy said, most of our program was 100% online. Then we transitioned a little by little into clinic. I have new students who are starting in April who are asking already, well, are we going to be online? Are we going to be in person? You know, things will change even, you know, in that time period, because we don't know which way the pandemic is going to go. So even this year, we don't know, you know, is it going to be a mixture? Is it going to be 50-50? We have to make sure everybody's safe, and we are making sure that we are accommodating all students, all new students especially. So if a person does get into the program, be assured that you are going to finish successfully. You're going to have all your clinic. You're going to learn, you know, you're going to get all the benefits and features that you were promised.
Yeah, absolutely. I think these are very good points. So that's exactly what we did too. We opted for a hybrid kind of an environment with the lectures being online. And if in the previous years without pandemic, if we did 2 hours of clinic time, we extended it to 4 hours with the same group, with the same chunks of time, so that they have like intense boot camp kind of a clinical opportunities, and reduce the number of days that they would practice, but increase the number of hours in a day to practice, extending it to the evenings, those kind of things. But we did get the same, we did make opportunities for the students even last year to get the similar kind of experiences than previously, but slightly probably delayed due to the initial core impact of the pandemic. But in the end, before they joined our third year class, they all did pretty much similar amount of clinical hours of work. Could be extended evenings, or the format of it has been changed, but they did get all the opportunities that they did previously. And luckily, we had an opportunity to open the school in June. So by the time they actually went into the third year, and even in its small groups, the patient care has gone up to 75% with small clinical areas operating and the hours extended. So all of them seem to be doing well, very well integrated, and with the number of competencies and expectations remain the same. Hopefully, as Corey said, it might be still in that hybrid environment this year. At least we are planning to put that kind of a schedule so that we are well prepared for it ahead, at least this year. Last year was a surprise, and putting it together in the last minute was the most grueling exercise that we did in between the pandemic. But we took care of our students. I'm sure every school took care of their students in the best possible way they can. And that's what we are planning to do even this year also. Give the similar amount of didactic and also clinical experiences in a slightly different format, maybe.
That's all really great advice. I'm going to throw out one last challenge to round out the session today. And I'm going to ask if you could each share one additional tip that maybe hasn't been covered yet today with the prospective applicants. Dr. Pimenta, could you kick us off?
This is what I always tell the applicants when they try to contact me. I just say, be yourself. Be yourself. Don't try to show a different person, because you're going to put yourself in a trap. If you get selected and you're not that person, you're in a trap. And if you don't convince people, you're in a trap anyway. So just be yourself, be honest, be transparent, just express well why you want to become a dentist in the United States. And I am sure that you're going to find a program that's going to fit in your dreams. Basically, that's it.
Yeah, if I have to say it, I think definitely what Dr. Pimentel said, but bring your confidence in clinical skills with a smile and humbleness. That's what we are looking for. A person who can fit within our environment and who can navigate the system independently and with some amount of confidence in their own clinical skills. Because you remember, you are a dentist, we want to treat you like one, but definitely you have to remember that you are a student here also.
And you know, I think being confident is very important, not just in clinical, but also just in yourself. I think what I typically leave students with after meeting with them, whether it's on the phone or through Zoom or in person, especially those who doubt themselves, because many of our applicants apply multiple times, some 2 times, some 3 times, some 4 times, some 5. So it gets exhausting after a while, and then you start to doubt yourself. So my lasting advice on all of our virtual information sessions, if I meet them on person or on the phone, is to, you know, look ahead, look up. Don't try not to doubt yourself. We all have doubts, but try to overcome those doubts with, you know, improving yourself. And as we go into this new application season, many are going to have to tell us how they've improved or what they've done, you know, since this last cycle. So be sure to show that confidence in clinical, in yourself, you know, and each other. You know, I think that's important that we look to each other, you know, to build that confidence.
May I just piggyback on this? I think another thing is be perseverant and resilient. Perseverance and resilience are 2 characteristics that are extremely important for any person to be successful in life. Life is a marathon, is not a short run. So be perseverant. If you did not get selected this year, check, see how you can improve your application. Always try to make your application better. Look back, contact the school and ask, what should I do to improve my application? And try to improve. This is another thing. If you did not get selected and you did not do much more for the next cycle, you're going to be doing the same thing. So you have to always try to get the feedback from the places where you apply to see what else you could do to make your application better. Always try to make your application better.
I'm kind of singing to the choir because pretty much my points have already been said, but I'll just restate them because I think they're important. I think Dr. Pimentel's discussion about being yourself is number 1 to me. We don't want you to do an activity because someone else says you should. We want you to follow your passions in dentistry. So if your passion is community service, do community service. If it's research, do research, but don't do research if you hate research. Like, that's not going to serve you or the people you're working with at all. So be yourself. Don't let other people, Corey mentioned this earlier, don't let the Facebook groups and the student doctor network and what have you tell you what you should write in your personal statement. Write your own personal statement, because if someone's telling you what to write, most likely someone else has written that same thing. And the personal statement is a place for you to set yourself apart from some of the other things. So try to set yourself apart there and don't follow a model that someone told you to follow. And then my second, so Dr. Pimentel told his advice, and then I was gonna basically use Dr. Potlori and Corey's advice after that. So again, with what they said, which is, you know, really the confidence and the perseverance, I think, is huge. And we often get, when we are asked for feedback, what did I do wrong? And the point of the matter is, like, a lot of times you did nothing wrong. Like, you absolutely did nothing wrong. So I know it can be discouraging to get a no, but what I like to say, the way I describe it is, we have people who are good and people who are outstanding. So how can you make yourself outstanding? It's not a matter of what did you do wrong. I mean, we do get applicants that probably aren't ready for a program yet, but more often than not, we have to say no at some point to someone. And so it just so happens it may or may not be you, but it's super competitive. So just keep persevering, ask for feedback, like Dr. Pimenta said. The last thing about that feedback is some schools will give feedback at certain times of year. So once our admission cycle opens, which is usually in October or so, we won't provide feedback anymore. So just be conscientious to ask for feedback when the school is giving it out also, because you might miss out on that opportunity.
May I just add one thing? I think this is the general, I would not say advice, but my perspective. The first phase of the selection process for the applicants is the most difficult because it's on paper.
Mm.
So it's very hard for us from the other side selecting to really differentiate who is who just looking on paper, on application. It's very hard. So that's the reason that we have a committee. We have people helping us because we have different perspectives from people reading the CVs in different ways. And then we try to put that together in a way that we're going to select the ones that we, at that moment, consider the best people for interview. Because once you go for the interview, it's already more selective. And then you can express yourself better because you're going to be talking to people, you're going to be interacting with people. So the first phase, like the statement letter, is extremely important because there is where you're going to probably show who you are. So don't try to copy or get a template because then you're going to be like others. So you have to show how different you are from others, that people will read that and say, whoa, I want to know this person better. I need to interview this person. So that is the key part, like on that big poll, how you're going to make yourself bright enough for people to look at you and say, I want to interview. I need to talk to that person. I need to learn more about this person. Maybe this is going to be a good fit for my program. That is, I think, a message to everybody applying. That is probably the, if I would apply, would be my challenge, how I can make myself selectable for interview.
And just one quick piggyback off of that, that goes back to the professionalism piece. I do think it's okay to get your application proofread. Don't change how your voice would sound. Don't change that fundamentally. But if, spelling's not your best skill, make sure that you're submitting a professional document, both in CAAPID and CVs and personal statements, wherever you're submitting things, just make sure that's also professional.
Yes.
And Emily, I'm so sorry. Just one last, the one thing that I just remembered that I tell candidates is to look at their, especially the ones who are applying multiple times. I don't know if the other schools have that situation, but look at your application as if you're hiring someone for your own practice, because many of them have their practices in their own countries where they've had to be the person on our side, and they had to look at this wealth of information or this wealth of experience from all these candidates, and then kind of look at you, be your own critic, I guess, in doing your application. Because I think some students or some applicants will kind of just do the application because, like Dr. Pimenta said, it's just all paper and it's just plugging in information. But think about it as this is your livelihood. This is, you're fighting for your life. There's thousands of other applicants against you, competitive, even more competitive. There's always going to be somebody better. So I think you kind of have to look at your application as if you're, critiquing it and do it honestly.
I think being authentic is very important. And trust me, we do not want 120 CE certificates in the application. As Marcy said, if you really like to do that course or do research, go ahead and do it, and we can see the authenticity through it. But don't fill your application for the sake of filling it, because more is not better. quality of it is better, and be authentic in the personal statement is very, very important. So yeah, I think all of them are excellent points. I think this would be helpful for the candidates, I think.
Thank you all so much for all of your pieces of advice. I appreciate your time and effort for the virtual fair. And on behalf of all of the participating programs, we wish all of the applicants best of luck this year.
Oh, and thank you for ADEA and
Thank you.
CAAPID for putting this together. It was a great initiative.
Thank
Yeah.
you.